Hello everyone, we are from SCDB 5 and we are going to present you our student project of post-term pregnancy. This is our member of the group. This is the chapter included in our student project. So for the first chapter, allow me, Amanda Reza Surinanda with the number of 237 to present you the background of the student project. So according to the United Nations, the data from the world population prospect, Indonesia had a declining total fertility rate. A total fertility rate is the average number of children a woman would have in her lifetime during her reproductive age. In the 90s, Indonesia had 3.10, and it went down to 2.13 in 2023. This number is lower than the world's TFR, which is 2.30 in the same year. Moreover, it is predicted that the numbers will go down. So this means that every one woman in Indonesia will bear two children during the fertility period. This TFR is influenced by various factors, which include lifestyles, environmental factors, and also socio-economic factors. Due to this, women are delaying pregnancy, and it means that the fertility levels will be declining more. So that's all from me. The next slide will be presented by my friend. Thank you.
Hello everyone, my name is Dewi Bintang Matasari with student number of 2002511211. So today I would like to explain more about pregnancy. Pregnancy itself takes time and has complex process. Fertilization occurs when a sperm successfully penetrates the ovum in the fallopian duct. Only those who has uterus are capable of becoming pregnant. This is why males cannot have pregnancy. Even though there are some researchers done so people who don't have uterus can also experience pregnancy. Good care for the woman before, during, and even after pregnancy will have healthy pregnancy, thus will deliver healthy child. But there are several abnormalities that can occur in the pregnancy. One of them is post-term pregnancy. It is estimated that post-term pregnancy accounts for 3 until 12% of all pregnancy cases. It is also said to be associated with increasing mortality and morbidity for the baby or the mother. Concerning these issues, we are eager to learn more about post-term pregnancy by constructing this project. So these are our problem formulations. This is our writing purpose. And this is the benefit of our project.
Hello everyone, my name is Stefanus Christian Surya with last 3 digit student number is 150. So now I will explain about the definition of postpartum pregnancy. Postpartum pregnancy is also known as a prolonged pregnancy, is an event of pregnancy that lasts up to 42 weeks or more from the last menstrual period. In addition, the term postpartum pregnancy is also used if there is an extension of the estimated delivery date up to 14 days. This condition appears in approximately 5 until 10% of all pregnancies, and it is associated with an increased risk of adverse outcomes for both the mother and the infant. That's all from me. Thank you.
Hello, my name is Miro Ambagris Richa with the last 3 digit number 018, and I will talk about the epidemiology. So first of all, we must know that only 4% or 1 in 20 of pregnant people give birth on their due date, and as many as 10% give birth post-term. Globally, post-term pregnancy occurs in approximately 3 to 12% of all pregnancies. The third fact that we must know that is that approximately 10% with the range of 3 to 14% of all singleton pregnancies persist beyond 42 weeks of gestation, and 4% with a range of 2% until 7% persist beyond 43 weeks of gestation without obstetric intervention. That is all from me. Thank you.
Hello, my name is Madi Kirana Chandra with the last 3 digit of my student ID number is 128, and I'm going to continue the presentations. So the real number of scope is likely to be less than the number mentioned because the most frequent cause of a post-term pregnancy diagnosis is inaccurate dating. Postpartum insights are more accurate. Post-pregnancy epidemiological data as well vary between and within countries, depending on the diversity of the study populations and differences in obstetric practice. That's all from me. Thank you.
Hello, my name is Mr. Emery. My last digits of student ID number is 081. Today I'm going to state about the etiology of post-term pregnancy. So inaccurate dating is the most common cause of prolonged pregnancies. Typically, the estimated delivery date or EDD is overestimated. But when it is really present, the cause is still unknown. But there are several risk factors, such as, for example, fetal distress, hypersomnia, meconium aspiration syndrome, stillbirth, and placenta previa. That's all from me. Thank you.
Okay, my name is Ananda Karaharja with last three digit of student ID numbers 136, and I will continue to the clinical findings of postpartum pregnancy. And there are no definite signs or symptoms of postpartum pregnancy, and some of the signs that may be seen include decreased fetal movement, decreased size of uterine, and rupture of the membranes with meconium-stained amniotic fluid. And the symptoms associated with post-maturity are less subcutaneous fat and soft tissue mass, lots of scalp hair, folds on the palms and soles, dry flaky skin, elongated and yellow stained nails, and discolored skin due to meconium staining. And conversely, some post-mature infants show no signs of post-maturity at all. Okay, maybe that's all from the clinical findings. The next slide will be continued by my friend. Thank you.
Hello, doctor and friends. My name is Petrolina Hadistiawan with last registration in number 097. Now I will explain to you about how to diagnose a postpartum pregnancies. Diagnosis of postpartum pregnancies. The first step in diagnosing a postpartum pregnancies is to determine the gestational age. The most common method that we use to determine the gestational age is based on the woman's last menstrual period, which is predicated on the assumption that woman has a regular cycles with 14 days of follicular phase. But in some patients, they have an irregular cycles, which is shorter or longer follicular phase. If the estimated gestational age determined by the patient last menstrual period is different from the ultrasound estimate, we should use the ultrasound estimate of gestational age. Why? Because the ultrasound dating is more accurate for determining the gestational age, and it may reduce the need for the labor induction in postpartum pregnancies. And there are several ways to diagnose postpartum pregnancies, including the ultrasound, physical examination, fetal monitoring, and maternal assessment. So for the ultrasound is capable accurately in determining the gestational age, and the ultrasound can detect if the pregnancy has gone beyond 42 weeks. And in the ultrasound of the postpartum pregnancy, we can see the decrease in total volume, the absence of anterior waters, flake-like inclusion in the amniotic fluid, and the presence of meconium in the fluid. Next is physical examination. So in the physical examination, we will perform a pelvic exam. So the pelvic exam is performed at prenatal appointment to assess the condition of the cervix. We can see if the cervix is dilated or not, and if the cervix become effaced. Next is fetal monitoring. Fetal monitoring function is to see if there a fetal distress or not. So we can use cardiotocography to see the fetal condition. Is there a violation or distress when the fetal heart rate decrease or increase? And last one is maternal assessment. So in the maternal assessment, we examine the mother to see the sign of complication. For the examples is preeclampsia, because the preeclampsia is the most common complication in postpartum pregnancies. Maybe that's all from me. For the next slide will be continued by my friend. Thank you.
My name is Putu Arisa Pradaswari, and I would like to explain about complication about postpartum pregnancy. For the complications from postpartum pregnancy associated with an overly long pregnancy may affect both the mother and the child. The mother may experience a more childbirth arduous and may suffer injuries to the birth canal. This increases the risk of infection and bleeding after delivery. Meanwhile, the baby may suffer from conditions such as oligohydramnios, abnormal growth patterns, or hypoglycemia, which is a low blood sugar level caused by an inadequate supply of glucose. And another potential serious complication of the postpartum pregnancy for a child is meconium aspiration syndrome, in which a child inhales their first stool. A baby who is unusually large may be more likely to suffer from birth trauma. In some tragic but rare cases, a baby may not survive the complication of the postpartum pregnancy itself. Maybe that's all from me. Will be continued by my friend. Thank you.
Okay, so continuing on, my name is Vivi Escala with 3-digit number 169, and I'm going to explain about the management. First of all, clinicians need to determine whether or not the pregnancy dating is postpartum. Precise pregnancy dating is needed so that doctor could decide if they need to do any intervention or not. Regular ultrasound examination is recommended as it demonstrates to be more precise than using the last menstrual period to calculate the expected date of delivery. USG can also be used to determine the volume of amniotic fluid to identify oligohydramnios. If examinations show any abnormalities or danger become apparent, the decisions for further therapy should be made. In low-risk pregnancy, if the patient decided to wait beyond their due date, antenatal fetal surveillance should be offered. Induction of labor should be considered from 41 plus 0 gestational week to 41 plus 6 gestational week, with more complications occurring in the latter half of the week. Continuing the pregnancy later than 42 plus 0 gestational week should be avoided, even if the patient doesn't have any risk factors. Patients with higher risk, such as maternal obesity with BMI more than 30 kilogram per meter square, smoking, and maternal age more than 35 years old should be proposed to do induction early on. That's all from me. Thank you.
Okay, thank you for your time. Hello, my name is Naomi Margaret Bayer Panjaitan, and my last 3 digit of student number is 167. Here I'm going to continue the presentation about the management. In dealing with postpartum pregnancy, we also have to inform patient that induction doesn't always result in high rates of caesarean section. Induction of labor can cause several concerns such as uterine overstimulation, fetal distress, increase in caesarean section rates, and can also cause failure of induction. The success rate is also depends on the cervical favorability. We can also do some preventions to avoid complication of postpartum pregnancy by giving prophylactic weekly membrane stripping starting from 38 gestational weeks, doing regular unprotected coitus approaching due date, acupuncture, and also by giving breast stimulation. However, these actions still need further studies before being definitely assessed. That's all from me. The next slide will be presented by my friends. Thank you.
Hello everyone, my name is Angelina Frutamulia with last 3 digit number 051. So next is our conclusion. So postpartum pregnancy or prolonged pregnancy is an event of pregnancy that lasts up to 42 weeks or more from the last menstrual period or an extension of estimated date of delivery up to 14 days. The cause of this pregnancy is usually unknown, but the primary cause is inaccurate dating. Postpartum pregnancy has no definite signs or symptoms, but some signs that may be seen are decreased fetal movement, decreased size of uterine due to reduced volume of amniotic fluid, and rupture of the membranes with meconium-stained amniotic fluid. It can be diagnosed by ultrasound, physical exam, fetal monitoring, and maternal assessment. The complications that may be occur are more arduous childbirth, injuries to the birth canal, infection and bleeding after delivery, oligohydramnions, abnormal growth patterns, hypoglycemia, meconium aspiration syndrome, and birth trauma. And some managements that can be done are antenatal fetal surveillance and induction of labor. So here are references that we use. Okay, so maybe that's all the presentation of our student project about postpartum pregnancy from SGDB 5. Thank you.